I think your journey, like many people with CUP, has not been a perfect one, and I think it's going to be really eye-opening to hear, everything from your point of view. We are very grateful.
Yeah, that was a great opportunity to come and actually speak to you all as a patient and as a patient's representative. But yeah, I think that initial question there, almost there, is kind of where I'm going to start. I did worry actually initially about you asking me, because I probably don't look too unwell as a cancer patient, and I'm about to start again with chemotherapy on Monday. I do have a PICC line put in my arm right now, so I am about to start again. But no, thank you so much for asking me to come and sort of share my experiences.
Thank you. So I think we've written some questions.
We have, yeah. You go. You start off with the questions, and I'll see if I can fill them.
Perfect. So I think first of all, it's if you could tell us a bit about the journey that you went through to reach your diagnosis.
Yes, I think, and this is where I think that where I sort of struggled, I think, at the beginning, because we were away on holiday and I had some real bad pain down in this lower groin, and we kind of figured out it was probably kidney stones. I had some of that pain a long time ago, but so yeah, it's quite an acute. I think you guys call it loin and groin, don't you? Yeah. So so I obviously went to the doctor when we got back and said, well, if it gets worse, go in A&E. Well, no one wants to go to A&E, do they? No one wants to go and sit in A&E for 6 hours. I did go in the end because it was quite an acute pain. Yeah, they gave me a scan, and I was seen. I think my initial visit with the guy in the hospital was, here's a very large pill. You need to take this. It's quite large. He said, yeah, and that goes in the other end. It goes. I've got 2 young nurses here. Would you like it? I said, no, I'll be fine. I can manage. So yeah, that's the pain out initially. I won't ramble on about that. But yeah, so that was my sort of first. So we did a scan. I spent the night in hospital. They came back and said, well, we found something. There is some sort of mass there that we can see. And from that point on, it got a bit vague. I left hospital, and then it was, well, I haven't heard from anybody. When I'm going to see somebody next, and that was sort of dwelling on my mind a bit. Well, a week or so later, I thought, well, I'm going to go back up to the ward in the hospital and ask the sister, what happens next, because I hadn't heard anything. And of course, poor old sister. Well, do you know how many staff I'm short of? She says, and I'm thinking, well, yeah, I do appreciate what you're doing here, but I haven't heard anything. What happens next? So I kind of left in limbo for a bit, and yeah, eventually got an appointment. And she said that it was probably 6 weeks before you were getting an appointment with a consultant. Well, you've already discovered something. Why am I waiting 6 weeks? So eventually, yeah, I did get an appointment to go back and see a consultant, and we went through those various checks and blood tests and all the other things that go with it. But it was very vague, I have to say. And I had other appointments after that where I would go and they would check my skin and just look at my legs to try and find out where this cancer might be coming from, because it wasn't apparent as to where it had come from.
Can I say at this point, we didn't actually even know they were looking for cancer at that point necessarily.
Well, yeah, it
was very vague.
It was very, very vague, yeah. And we were going to various different hospitals along the south coast, seeing different people, so not really getting to the bottom of it. Eventually, I think it was the fact that we could have a biopsy, but this was probably 2 months in now. And I don't know if any of you have ever looked on a website to have a look to see when CUP actually is the life expectancy of CUP. I think for the first year is 25%. For 5 years, it's 15%, and that's a real concern when someone says you may have got that. That's what you're looking at. But that obviously came about through the biopsy. That's where we found out about that. So yeah, that was my sort of initial response, and I know Linda looked that up. Probably you didn't tell me, did you, that was the life expectancy? So, and obviously Linda was obviously struggling with that completely. But yeah, so we then went on to have the sigmoidoscopy. Oh my goodness! Well, that's, yeah. I don't know if any of you guys have had one of these, but yeah, that's something to experience. Yeah, or not. So yeah, that's probably the worst bit I've been through. But it was basically the delays, and in the end, it felt like luck, really, that I got to come and see you in the end. And I thought, well, you know, why haven't we done 3 months? I probably, you know, in my mind, I could have been dead within 3 months. So eventually we got to see you, and then you feel you're in the right place, and you guys just sort of took it forward, and we had a plan, and we worked out what we were going to do. So yeah, I think at that point it suddenly sort of it settled down a bit, and I felt more comfortable with what was going on. But up until that point, it really was, why aren't we dealing with this? What's going on? So that was my initial response. That's, you know, that's where we were.
I think sadly that's the case in Clapton. It really wasn't a great journey, was it? It took a very long time.
But I do understand that's probably changed, doesn't it? Now that has changed. Yeah.
I hope that we are in a better place now than we were then. So I wondered if you could tell us a bit about the treatment that you've undergone so far.
Yeah, well, obviously I've had the chemotherapy. I mean, I think that was 6 sessions over, you know, with 3-week gaps in between. And surprisingly, that went quite well. I didn't feel that ill. I have seen my previous wife go through cancer treatment, and that was some 30 years ago, and it was really, really not good at all. But I was expecting something far worse. So I have to say the chemotherapy was actually quite good. I didn't get the sickness that I was expecting. I pretty much carried on as normal, very, very tired, obviously, but it brings about that sort of suddenly, because I'm very active. I cycle, I canoe, I motorcycle, I do all sorts of things. We run a small holding between us, so there are always jobs to do. There's animals to look after. So that sudden change of life, that suddenly not being able to do what you normally do, is a really big mental problem, really, because I'm used to being active, and that for me was very, very difficult. I think it took me quite a time, didn't it, Linda, to get past the fact that, yeah, you could quite easily get depressed because you're not being active. I think that was quite a big thing for me. But so adjusting your life is quite a big thing. And obviously, Linda having to adjust her life around mine as well, while still trying to run everything. I think then we went on to radiotherapy, which was 6 weeks. I think it was nearly 6 weeks of radiotherapy, and actually driving down an hour and a half to Singleton every day. I drove myself. I was perfectly fine. So I drove myself down, and the staff in there are just marvellous. They really are quite something. I did try to take control of that situation myself, because you do feel out of control of your whole life at these points, because someone else is dealing with you and on this medical sort of side of things. And one of the ways I tried to keep control of it was trying to remember the names of all the staff that I was seeing every time I went in every day. And there's quite a number of staff in there, isn't there? There must be at least 20 or 30.
Yeah.
So that was my only way of trying to keep control of what was going on. So I found that quite useful, even though I made mistakes and got something wrong. But yeah, I found that a really useful thing to do. But the radiotherapy was probably a lot worse than the chemotherapy, because it was down here in the bowel area. So you can imagine 6 weeks of that. Actually, that's quite an effect. It's all right to start with, and they're very good at giving you creams and things to actually, you know, suppress the burning. And you think, oh, this is fine to start with. But as time goes on, that becomes very, very sore. We did make the mistake of going cycling one day straight after, didn't we? I didn't do that again. I have to tell you, I didn't do that again. But yeah, so it's quite an experience. But that radiotherapy was really so good in there, because if you went in with a problem that particular day, there was always someone on hand to go and talk to in a separate room to just go through those, you know, I'm getting constipated, or you know, I'm having trouble doing this. So there was always someone there on hand. And that was run so well. I was so pleased to be there every day, even though you do have to arrive with a full bladder, and there's a lot of timing that goes on before you actually get to the hospital.
Yeah, for anybody that needs to drive from Llandudno to Singleton, you stop at the services on the way, you go to the loo, and then you drink from there all the way to Singleton. Yeah.
So I kind of worked out it's 45 minutes between drinking the litre to actually getting to the point where you needed to empty. So yeah, it's quite, but they were very good scanning you down there for all that. So yeah, so that was my radiotherapy. And yeah, where are we since the radiotherapy? We kind of, gradually, yeah, it's worked to an extent, hasn't it? So yeah, we've done quite well. I know it was a little bit of guesswork on trying to decide whether it was bowel cancer or an anal cancer. So, but we seem to be on the right track. But so over that time, we're talking about, we finished 2023 in October with the treatment. So last year, I'm building up my strength again, my energy, I'm cycling and doing all these sorts of things. So I'm feeling pretty good. And then we're coming back to square one again, which I'm going to take this on again. So yeah, so it's going to take a lot of what shall I call it? Just deep down, yeah, carry on. So yeah, it's a tough place to be at the moment. Having just got really fit and active again, it's going to be quite tough just to start again. But hey, look, we'll dig in and see how we get on.
Absolutely. I think one thing that I think we're interested in about is, thinking about the unknown primary aspect of it. Did that make a big difference to you, do you think?
I think it does, because if you talk to family and friends, you somehow have to explain you've got cancer, but we don't know what it is. And that's quite a tough one for family and friends to take on. Yes, I think I see it from my point of view, but obviously there's this other picture of family and friends, and Linda obviously at the forefront, who are struggling with you, really. Yeah. And of course, you know as well as I do, the minute you tell somebody you've got cancer, they all come to visit you, don't they? Because it may be the last few months they've got to visit. But it's quite difficult to explain the unknown primary. Yeah. I'm still struggling with it now, but it's very interesting to sort of just see what was talked about there as to what's going on here. So it's very encouraging to see that things are moving forward. And it appears I've sort of arrived at the right point almost with my diagnosis anyway. So yeah, what else can I say about that? Yeah.
I think that so it brings us on to, do you think it's made things more difficult psychologically for you with it being unknown primary?
I think it probably has, because most things you get medically, don't you? You kind of go to the doctor, you get some pills, you might have an operation, you fix it, you move on. Okay, but this is a life change, isn't it, really? And it's an unknown life change. So I don't know at this point whether you guys can how long you can keep me going. You've done a marvellous job up till now, but I really don't know what that future holds, because it is unknown. So that's the thing that plays on my mind a little bit. So we are making the most of every day, and we had a lot of holidays last year, and just making the most of time, really. So the unknown, yeah, well, it's unknown, isn't it? So it's unknown with me. My worry is it's slightly unknown with you guys as well. But you do seem to be doing the best you can. I know funds are short, and you're doing the best you can, aren't you? So yeah, what else can I say about that? Yeah, let's keep plugging on and doing what we can. I'm not the only one, obviously. I'm just here as a representative. So it's all those other guys out there that, yeah, are struggling the same.
Are there any parts of your journey that could have been made better that we could learn from as health professionals?
Well, obviously that first diagnosis, I mean, it should never ever take that long, should it? I think you probably all appreciate that. But I think one of the things we've probably talked about is not just me, it's the partner, is Linda there, and anyone else in that position. It's not just about me. I've got the easy bit, really. I just turn up and you do whatever you need to do. And I get podded, poked, cut, or whatever I need to do. But it's that mental side, isn't it? That stress that comes with the whole package, and obviously the carer. And I did lose my first wife to cancer, so I do know what it's like to be a carer, to look after someone in this position. So I'm very empathetic towards Linda's position. That you do have to carry a lot. There's a lot of stress there. What's the future going to be? Why is he changing? Why is he different? Why is his mood different? How can I explain it? Yeah, but we've had a lot of help, haven't we, Linda? Yeah. So we're not on our own. We're a big family. We have lots of friends. We have a church group. So we have all these sort of backup systems in place. But I'm well aware that not everybody has that, do they? Not everybody has that. So we've been very fortunate that we are in that position. With you guys as well, there's always someone to talk to, having a dedicated nurse over the phone that I can just call. We've got Lynn, haven't we? So and various others. So just having that point of contact is really, really important. And what I've also found is the bureaucracy. Well, you all know about bureaucracy, don't you? Because yes, we all get tied up in these systems. And actually, the best thing for me has been when the nurse phones up and says, you've got an appointment next Monday. And that is so much easier. You know, I talk to some, we've all got mobiles. It's kind of such an easy thing to do, but it gives you peace of mind. You don't have to wait for the piece of paper, which may have been lost. I've been to appointments before, and the consultant says, well, why are you here? Well, I've come from a stigmoidoscopy. Well, it's not ready yet. You've got to go home and take the laxative and the rest of it. So it's things get mixed up, don't they? And obviously, I'm of a younger generation, not that young, a younger generation than my father, where the older people would just sit there and wait for the letter. Well, the letter may never come. So in my view, yeah, you have to be quite proactive as a patient, because if I haven't heard from you, I'm going to call you because you should have called me. And quite often, one of the nice things is that you guys do say that if you don't hear from us, give us a call. So I found that really quite helpful. Yeah, so yeah, there are lots of plus points. I try not to dwell on the negatives because it's, you know, there are obviously negatives, but I'm in your hands. I put myself in your hands, so I'm trusting. There's a huge amount of trust that goes with this from the patient's point of view, because we don't know how your systems work really. We're just the centre point, being the patient, and we really don't know how your systems work. But I do get an idea when it goes wrong because I haven't had the letter or something else hasn't happened. So, but you know, I can keep an eye on it, but not everyone would do that. But I think it's a good point to make that, you know, but that older generation would sit and wait for the letter rather than phone up and say, hey, why haven't you called me? So yeah, proactive is as a patient, I think is quite important.
Absolutely. I think we said that we've got positive and any helpful things that happen. I think we've gone over. So any messages, take-home messages for us as teams helping patients and families affected by unknown primary cancer.
Yeah, I think one of the things, and what I must plug is at Singleton Hospital down in Swansea, we have Maggie's right next door, which has been hugely helpful for myself, but mainly for Linda. Just to go in and have a chat about the current situation while I'm having an appointment. Linda can go and get a coffee and have a chat with someone just to discuss, you know, how things are on the psychological level. And that's really, really important because, you know, my support will be Linda. And for her, that has been really, really important just to talk things
It's
through.
having an independent person to talk to. It's all very well having family and friends, but they don't want to hear the bottom end. They just want to hear that it's okay today sort of bit.
Yeah.
And it's really nice to have somebody independent that you can just sit down and actually say, look, I'm not doing very well today.
Yeah.
Because everybody says to me, how's Ian? I'm here as well.
Yeah. I told you to get a t-shirt, didn't I?
Yeah, my t-shirt's going to say he's okay, but I'm not.
I know, it's important to remember, isn't it? It's a journey for both of us, and that's the important thing to remember. It's not just about the patient, it really is about the other person. And one of the things we've found really useful since we've been slowly getting better is that we've done alternative therapies. So we've been doing yoga, reflexology, massages, which we go. We've got the Old Mill Foundation, which is not far from us down in Llandudno, which we go to on a Tuesday, which is kind of donations. It's been set up to help cancer patients and their carers, just to give them some sort of relief with different therapies, which has been really, really useful. And the yoga and the breathing has been really useful just to get the body back working again. That's been really, really helpful. So yeah, so we worked hard on this. Yeah. So with your help as well, yeah, we kind of got to this point. So yeah, just wait to see where we go next, really.
Absolutely. I think, are there any other things that you think are important? So I think that's all our written down questions.
Yeah, let me just have a little quickly through my little notes here. Yeah. I think one of the big things I struggled with the chemotherapy was the temperature. You know, you're constantly taking your temperature. That is such a big worry for a patient about taking your temperature because you all worry about infection, sepsis coming in. You know, there's that, you know, if there's an issue, phone the nurse. And that I remember that being, and I'm not looking forward to this again because that was quite a big thing because you're constantly, you know, looking at your temperature and taking your temperature. And we have to be careful because some of those temperature gauges we use for the sheep and the lambs. The batteries don't always work. You go, so I've got one. No. So yeah, we do need to be a little bit careful. But other than that, yeah, it's yeah, I think I've probably covered most of what I wanted to say really. But, yeah, I think really it's a lot of it is just having confidence in the system. And you kind of see gaps, especially the bureaucracy side, you know, the paperwork and things. But once I get to someone on the ground floor, you guys, I get to talk to you. It's so much simpler. I mean, I can walk into the day centre in Llandudno and the hospital, and I can get an appointment when I talk to the guy at the desk. I don't need the paperwork in between because it gets in the way. So yeah, that's my experience of it. Is yeah, we've been quite proactive really. So I think that's probably helped in the long run. But and I should carry on being proactive.
Absolutely.
I'm on your case anyway.
Yeah,
so-
yeah. Okay, fine. So much.
Yes, you're very welcome. Thank you for the opportunity.